Hi guys, my name is Sean Pinto, and today we'll be discussing exercise intervention for older adults with osteoporosis or low bone density. So why study osteoporosis? Well, as the population continues to age, more individuals are being diagnosed with osteoporosis, which is now considered a public health concern. 22 million women are affected in the European Union, and 1 out of every 3 women are at risk of experiencing an osteoporotic fracture. 2 million men in the US have osteoporosis today, and men account for over 3.5 million osteoporotic fractures annually. Bones are not only important for structural support and movement, but also make red and white blood cells. They are important for storage sites for minerals, and new research indicates they may play a role in metabolism. As you can see, osteoporosis affects many people, but what is it? Osteoporosis is a metabolic disease with systemic osteopenia, bone microstructure deterioration, increased osteoarthrosis, and decreased bone strength. It occurs when there is a disruption in balance between bone formation and resorption. The worst outcome of osteoporosis is that bone fragility increases the risk of fracture. Risk of death is 2.7 times higher for women who experience a fracture compared to those who have not. Additional symptoms include whole body pain, a decrease in height, and kyphosis. Another study by KERR and colleagues studied how osteoporosis affects physical function and leads to a cycle of impairment, limitation, and restriction. These researchers believed it was important to analyze how treatments impact patients because it could help healthcare professionals prescribe better treatment options and increase compliance among patients. This figure represents the cycle of impairment and fracture in KERR's study. As you can see, a fracture can have psychological and social impacts. Fear of falling can increase, depression, altered body image, and low self-esteem. There are also comorbid conditions, such as beliefs about physical activity and fracture. So even if a doctor prescribes the perfect exercise program for a patient, if they're too afraid to exercise, they might not comply with the program. Next, let's look at the way exercise affects cells involved in bone homeostasis. Bones constantly adapt to the body's needs through a cycle of formation where bone stress is high and resorption of bone cells where stress is low or cells have died. This makes the skeletal system a very adaptive organ that can meet the demands of different mechanical loads or metabolic needs. Mesenchymal stem cells are the first cells we're going to cover, and they have the ability to differentiate into osteoblasts, adipocytes, and chondrocytes. They are located in bone marrow where they experience mechanical signals like strain, pressure, fluid flow, electricity, and acceleration. Multiple studies have shown that exercise leads to increased differentiation of these mesenchymal stem cells towards osteoblasts and inhibits adipocyte differentiation. Osteoblasts are another important cell that are responsible for bone formation, bone matrix synthesis, and bone mineralization. They also play key roles in regulating the activity of osteoclasts via the release of rank L and OPG. Exercise increases activity of osteoblasts while inhibiting the activity of osteoclasts. Osteoclasts come from hematopoietic stem cells and can reabsorb calcified tissue. Mechanical signals seem to reduce their activity via the increased expression of OPG by osteoblasts. The last cell we're going to cover are osteocytes, which are bone cells that can sense mechanical signals like shear stress and hydrostatic pressure. These signals reduce the rate of apoptosis or cell death and are necessary for their survival. So let's look at mechanical signals. Exercise leads to an increase in mechanical signals such as fluid flow, dynamic tension, compression, and hydrostatic pressure. These signals upregulate osteogenic differentiation and inhibit adipogenic differentiation, which may be one of the main reasons why exercise prevents the development of osteoporosis. Osteogenic markers are released during osteoblast differentiation and help indicate when bone is in an anabolic state. Some of these markers include ALP, OCL, RUNX2, and OSX. There are multiple signaling pathways that are activated by exercise. One of them is the BMP pathway, which is activated by cyclic compression and increases ALP and RUNX2 expression. ALP accelerates calcium mineralization in humans, in human bone, and RUNX2 is a transcription factor that upregulates osteoblast differentiation. The WNT beta-catenin pathway is activated by fluid flow. This pathway also increases the expression of the osteogenic marker RUNX2. Osteocytes can turn off this pathway by releasing sclerostin. Recent findings indicate that exercise downregulates sclerostin expression by osteocyte favoring of osteoblastogenesis. This leads to greater activity and differentiation of osteoblasts. Both rank L and OPG are expressed by osteoblasts and control the activity of osteoclasts. Exercise influences this pathway by increasing the expression of OPG while reducing the expression of rank L. OPG blocks the ability of rank L to bind onto osteoclasts and activate them. The increase in OPG rank L ratio leads to a decrease in bone resorption. I know that was a lot of information, so I create a little summary here that you guys can pause the video and review now. So exercise has many effects on bone cells, but it also has an effect on hormones. Moderate exercise increases the levels of PGE2 and estrogen. PGE2 has been shown to increase bone formation and bone mass, and estrogen inhibits the death of mesenchymal stem cells and increases their number in normal and OVX rats. Moderate exercise can also increase the levels of anti-inflammatory cytokines and decrease the level of pro-inflammatory cytokines. This is beneficial to patients with osteoporosis because anti-inflammatory cytokines promote bone formation, while pro-inflammatory cytokines increase bone resorption by activating osteoclasts. Now let's look at the type of exercise that is best to prescribe to patients with osteoporosis. An expert panel on osteoporosis reviewed multiple studies and came to the conclusion that a multi-component exercise program including resistance and balance training has the best outcome because it decreases the risk of falls. Balance and strength are key components for fall prevention, and one study looked at how effective a basic exercise program can be to increase strength and balance in osteoporotic women. The trial lasted 6 months and included a warm-up, static balance, dynamic balance, muscular strength, and cool-down portion. Each exercise session lasted 60 minutes and performed 3 times per week. The exercise routine was designed to increase intensity over time depending on each patient's abilities. The equipment was cheap to show that anyone could exercise without economic restriction or access to expensive equipment. The results showed a 21% increase in static balance, 36% increase in dynamic balance, 80% increase in strength of the upper body, and 47% increase in strength of the lower body. This program shows drastic improvement, which might have been influenced by the fact that participants for the study were untrained and had not exercised in 2 years. Nonetheless, this study shows that exercise is beneficial to women with osteoporosis and that a low-intensity exercise program improves balance and strength if volume is sufficient. Here are some guidelines to a resistance and balance program that you can include. Pause the video to review. I also wanted to include some examples of balance exercises that have been used in clinical trials. Pause the video again to review. The last study we're going to look at is a jump versus resistance training program that was designed for men with low bone mass. The resistance training group trained 2 times per week for 12 months, while the jump training group trained 3 times per week for 12 months. Resistance training targeted the hip and spine with exercises like rows, modified deadlifts, military press, lunges, and calf raises. Intensity increased throughout the 12 months. The jump training increased its intensity by progressing exercises and increasing training volume. An example of this would be a squat progressing to a jump squat and then to jumping off of a box. A DEXA scan showed results of a 0.6% increase in whole body bone mineral density with both exercise programs. Lumbar spine bone mineral density increased by 1.3% with both programs, but total hip bone mineral density only improved with resistance training by 0.8%. This small increase in bone density is significant because bone mineral density is naturally lost every year as a product of age at rates of 0.4 to 1.5%. These programs not only stopped further bone loss, but actually improved bone mineral density. Additionally, small increases in bone mineral density result in large increases in bone strength. This proves that both jump and resistance training can increase bone mineral density in older men with low bone mass. I also want to quickly look over some safety considerations. Load-driven adaptation should be facilitated through dynamic exercise, which stimulates bone formation rather than static exercise, which can cause bone deterioration. An exercise routine should progress to increase intensity within the capabilities of the patient. Some ways to modify intensity include changing the number of reps, the number of exercises, exercise duration, rest time, velocity, and load. Also, whenever you're designing an exercise program, you want to limit accidental falls by having support objects close by, and be aware of weather like rain that can make the ground slippery. Avoid quick shifts or twisting movements during transitions between exercises. This is especially important for patients who have experienced fractures in the past. Slow and controlled movements should be performed. You also want to avoid high intensity programs, but remember that low intensity exercise program will take longer to see results. A minimum of 8 weeks is recommended to see improvements in strength. Alright, so to conclude this discussion, exercise is sensed by many of the cells responsible for bone homeostasis as mechanical signals, and these signals tend to upregulate the activity of osteoblasts while decreasing the catabolic effects of osteoclasts. Strength and balance programs can effectively reduce the risk of falls, which usually result in fractures, and a resistance and jump training program can increase bone mineral density and decrease the natural bone mineral density loss seen with age. I'm also providing a key here for some of the words that were abbreviated. Feel free to pause the video here. Thank you so much, and I'll see you next time.